Health officials in the US state of Texas have recorded a case of the Zika virus, which was sexually transmitted. They say the patient was infected after having sex with someone who had returned from Venezuela. Zika is carried by mosquitoes, and this is only the second known case of sexual transmission. It raises concerns that the virus could spread, even in countries where the mosquito isn't found. Well, Venezuela is one of about 20 countries in the Americas where Zika is spreading. The virus is linked to a condition in babies called microcephaly, where infants are born with small heads. Brazil has been the worst hit and has now confirmed more than 4,000 cases of microcephaly. Well, Gregory Hartl is a spokesman for the World Health Organization, and he joins us now from Geneva. Gregory, thank you very much for your time this morning. How significant then, if at all, is this development in Texas?
Yes, thank you. First of all, let's go to the microcephaly angle. The microcephaly, first of all, we don't know if all 4,000 cases are confirmed. They're suspected cases, although we have to investigate further into that. We also need to look further at the link between Zika and microcephaly. That's not actually been proven yet that one causes the other. We do have coincidence of Zika both in time and place to microcephaly cases in Brazil, but we don't have that link anywhere else, or we did in French Polynesia, but currently in the Americas, it's nowhere else. So really we need to be careful before we make too strong or too definitive a link between Zika and microcephaly. There's more research needed. That's one of the priorities for WHO, is really to look what is causing microcephaly. Is it Zika? Is it Zika plus something else? Or is it something else?
What stage of the research?
Microcephaly is a terrible condition.
Sorry, Gregory, what stage of the research is the process at the moment? How close are scientists to establishing a link between Zika and microcephaly?
Well, there are case control studies which have started, and new studies will also be starting soon. We don't believe that we will have, though, an answer for the next 6 to 9 months. Sometimes it's very difficult to prove the link. Again, what's a bit of a puzzle for us, for example, is so far cases have only been reported in the northeast of Brazil and in French Polynesia in 2013-14. Why are there not cases elsewhere? There could well be cofactors, but it could well be Zika. We really are not 100% sure for the moment. In most people, if not almost all people, Zika causes only extremely mild symptoms or no symptoms at all. In 3/4 of the cases, Zika doesn't even cause symptoms.
Is the scientific world working on the premise that there is a connection, or does it not work that way? And if there isn't a connection between Zika and microcephaly, what are the implications of that? Well,
yes, certainly. The premise at the moment is that there is an association, and can we go from proving an association, which means the association means that the cases are occurring in the same place and time, both Zika and microcephaly. Now, it's much more difficult to call something a cause and effect rather than an association. So the more studies you do that show an association and that do not show anything else, the more likely you can say, okay, it is Zika, which is causing microcephaly. And that's what we're working on now, developing case control studies both in Brazil and elsewhere.
And going back to the case in Texas in the United States, where the virus was transmitted sexually, is that something that took the medical world by surprise, or was it in some way expected that this development would occur?
Well, again, this shows that we don't know much about Zika. Zika is something which is really a new virus for most people, even though it was first isolated in 1947 in Africa and has since traveled around the world, from Africa to Asia, from Asia to the Pacific from Latin America. There were very, very few cases up until about 8-10 years ago. So the evidence we have is small. We know that the mosquito is responsible for 99, if not 99.99% of the transmission. So for us, what is absolutely the most important is the control of mosquitoes, as the pictures right now are showing. That's what one needs to do and concentrate on, because if you reduce exposure to mosquitoes, both on a population basis and on a personal basis, you drastically reduce the chance of contracting Zika.
Okay, Gregory Hartl, thank you very much for your time.